cosmetic surgery at a transplantation center. We do the hair transplantation by the method follicular unit extraction and implantation. So in this procedure, we'll trim the hair first of all to 2 to 3 millimeters length. Then we'll after trimming, we'll mark the front hairline and the deficiencies where they are there. We mark the hairless eyelids along with marker pen. Then we'll make the patient lie over with the face down on the table. Then we'll inject xylocaine or lidocaine to anesthetize the area. It will cause local anesthesia and the client will not feel any pain because of this local anesthesia. Then we'll mark the occipital region and back of the head with the marker pen, the squares from where we'll be collecting the hair follicles. Then we'll start extracting the hair from each square. Then after extracting, we'll maintain the cold chain so that the hair follicle doesn't get damaged. The root is important. While extracting, we'll take a where we have implanted, we'll put normal saline and we'll try to, where there is disruption of the hair, we'll re-implant properly and then we'll end the procedure there. We'll give a surgical cap to prevent the dust to enter the implanted site. Then we ask the client to come after 2 days when we give a betadine and antiseptic hair wash and shampooing with Johnson baby shampoo. Then afterwards we'll be giving them an antibiotic for about 10 days and anti-inflammatory drugs, and for better healing we'll give zinc and vitamin C, and the client will come after 15 days for checkup. As a post-operative advice, we advise the patient to sleep head upside, face upside, looking at the ceiling, not or to a side, to prevent swelling of the face.